hopefully people will be able to show up.
I hope so. Otherwise, it's always good to see you.
Yeah, and we can certainly chat about our project a little more if
Yeah. Where are you right now?
I'm in New York right
That's
now.
what I thought. Yeah.
Yeah.
All those tall buildings.
Yeah, the Empire State Building is just like right there.
Really? Oh, cool. So
So,
you're right in the middle of Manhattan.
yep, we're in the thick of it for sure.
Wow.
Yeah. Well, let's see. Let me see who all has signed up for this. Um,
There's somebody.
oh, good. Yeah, it might just take a minute.
It took me a while to find the link, so maybe other people are having the problem.
That's what I'm wondering if it's, yeah, if it's a bit. Um, it should have sent out reminders with the link in it, but
Did yesterday, I think.
yeah. Hi, Amy.
I, hi.
Just looking to see who is attending here. These tend to be fairly small right now. They're a new thing that we've started, so they're kind of,
Oh, okay. I've never attended one, so I just thought this was an interesting topic I would sit in on.
yeah. Um, I'm just looking up who else is.
Okay, we have someone else, Aaron.
eh, Options. We had about 37 people accept this, but not everybody always attends them. They get busy. Um, but they are usually small. They are meant to be kind of informal. Um, and so we can we can start and other people may join. Um, so um, yeah, these are meant to be very informal. You guys can feel free to unmute yourself, come off camera, whatever you would like to do. They're very meant to be conversational. Um, and Aaron, would you like to just mention who you are with? I see the EPA R10. Is that, I'm not sure what organization you're with. Could you let us know?
Yes, sorry, let me get you situated so
Sure.
I can see. Hi, yeah, I'm with EPA Region 10, which serves the Pacific Northwest and Alaska, so federal agency. I'm in our air program, and my role is around coordinating on wildfire smoke, and and multiple sources of smoke, but especially wildfire smoke, and my background's in public health, so this caught my interest and I popped
Great.
on.
Great. And Amy, we've talked, I think we work mostly with Chris Chen at the HCA, but do you want to introduce yourself quickly?
Sure. So Amy Wolf, I'm a occupational nurse consultant. I predominantly work with disabled dependent program, but also work on some of the healthcare contracts and so forth. So um, I've been with the agency about 3 years now.
Great. And I see Angela. Angela joined us. Angela, do you want to introduce yourself really quickly?
Yes, good morning. Sorry, I'm under the weather this morning. I'm the local emergency response coordinator for the Walla Walla County Department of Community Health. So I work at the health department in Walla Walla County. Thanks for having me.
Great. Yeah, so these are being recorded. Just FYI, these are meant to be very informal. I will give you a little bit of idea of just what the Bree does and what our report is about. And then they're really meant for people who are interested in the topic to think about how to start planning, evaluating their implementation changes. So if you're taking the report and implementing some of these activities, how do you evaluate them? How can you share information with other people who are doing the same thing? How can you connect with other organizations that are working on these topics? That's really what this is about. So I will share my screen and pull up my slides quickly here. So just so you guys know the Bree Collaborative writes guidelines for Washington State, but these guidelines are used across the US as well. And I also found out recently in Pakistan, of all places, has a little bit of international footprint. And just a few little housekeeping. We introduced ourselves, and this is, like I said, this is really a place for you guys to connect. So this is kind of an overview of what the Bree does. We were established by legislative statute to improve places in the healthcare system or choose topics where best practices aren't understood by all actors yet. So payers and providers and public health agencies, community-based organizations. We write guidelines to help figure out how we can help this system work together. And then we submit those guidelines to the HCA, but they also go to other entities, private payers, private organizations like Microsoft and Amazon who pay for their own care. They go down to health plans, all the way down to community-based organization level. And my role at the Bree is evaluation. So we have an implementation manager and we have an evaluation manager, and that's me. And our aim is really to get people thinking about evaluation even as they begin to implement different things. So we've created some tools. Some of them are very general for evaluation. They're like, how to do a logic model, and there's a little statistical program that's free, different things like that. And then we've created some other collaborative tools. So these collaborative tools are like survey banks, measurement banks, where you can take your homegrown measures and you can submit them to that bank and you can share them with other organizations. And there are a few already in the heat and wildfire smoke that DOH and L&I have shared. And it really is meant to get everybody kind of on the same page, generate ideas about how to measure something. And then we have these kind of self-report tools. They're primarily around they're called scorecards. And we have a framework for this topic. So just kind of a narrative on how to evaluate and how to think about your role in the system. And then our scorecards are meant to help you measure fidelity with best practices. So those are kind of the tools that we provide for you, and I can go over any of these. If you guys are interested in them, we can chat about them. This link here, this QR code here is for our evaluation framework. So you can have a copy yourself. You can look it over, read it over, kind of get you started, orient you to what the guidelines are about and how to measure them, sort of thing. So we can talk about those a little bit more as the hour goes on. I wanted first, though, to give a chance for Janet to chat a little bit. Janet is with the Thurston County Climate Action Team, and she became aware of the Bree guidelines through the Thurston County Public Health Department, and we have been helping them evaluate their pilot program. And I wanted to give her a chance to talk about like how she, how she has used the guidelines and to inform their pilot program and how we're working on evaluating them. So Janet, I will let you go ahead and chat, and I'll pin you for everybody.
So we are just a small nonprofit in Thurston County. I'm the executive director. We have a pilot program that we got a grant from Front and Centered to do work on extreme heat. And the pilot program has two parts. One part is we're doing, well, the pilot program is one part, and then the other part is education. So pilot program is we're giving out 50 portable heat pumps to vulnerable communities in Thurston County. And the other part of the program is to educate people about the dangers of extreme heat, the symptoms, and how they can take care of themselves, how they can prepare for extreme heat, and how they can, if they do get sick, what they should do. So, so Carrie and I have been working, gosh, for how many months? 4 or 5 months? I don't know.
Yeah, yeah.
And so what she's really helping with, like we did a theory of change document, and then we've also used the logic model, and we're using it for a variety of things. First, it was just to help set up the program and think about who are we trying to reach, and what our audience is. And then we've used it for, we're doing a pre and post survey. So have definitely used the Bree to help figure out what survey questions we should ask. And then we're also working on evaluation and what do we want to evaluate, what data do we want to collect, and we're still in the middle of all this, so it's all new, but I've just found that their resources are extremely helpful, especially for someone like me who this is all new to. And that's kind of what we're doing right now. So we're in the process of, actually given out the 50 heat pumps. They haven't all been installed yet. We're using Habitat for Humanity to install them. And I'm actually going on an installation tomorrow for 2 of them. And then August 1st is our first presentation at a senior living facility, and we're giving the presentation. And then we also will be doing the surveys. We've started doing the pre-survey to the people who are getting the heat pumps. So that's kind of where we are right now.
Thanks, Janet.
Mhm.
Yeah, so this, like I said, this is really about kind of sharing. So what I'd like to do is kind of invite you guys to talk about where you are in terms of implementing any changes to the way that you're responding to heat and wildfire smoke. Are you using Bree guidelines? Are you using other guidelines? And so, yeah, so I just wanted to open it up to anybody who is interested in starting. And go ahead. I heard somebody starting.
One thing we didn't do is like we didn't everybody didn't say who they were or what they're, maybe if we do that, it would help people,
Yeah,
like how they think this Bree could help them.
yeah. I see we do have a few new people. So I see Jesse and Joshua are on. Would you guys like to introduce yourselves and just talk about what work you're currently doing?
Yeah, I can go first. I'm over here in Idaho, actually. I came across this and wanted to check it out. I work with Essence Data here in Idaho, Division of Public Health and the Department of Health and Welfare. And I'm a Tableau dashboard guy. And so one of my dashboards right now it's just internal, but one of them are on seasonal conditions and especially out here in Idaho with the desert heat and everything. So I want to kind of, I'm just here to really try to listen in and hear. But basically, yeah, what I'm doing is I'm on my dashboard. I have a lot of heat related illnesses that I highlight from the Essence. For anybody who doesn't know Essence, it's the uh, emergency department data that they all plug into a system that I'm able to then kind of pull out and find maybe any trends that are happening or anything like that. And so yeah, so I have a heat and a wildfire and smoke and other respiratory illness on the one dashboard, and the other side is the cold related. So we kind of have both of the extremes. So
Interesting.
I know our EPIs really use the dashboard to try to see if there's any trends, and it kind of called out any kind of have any like news worthy articles to let people know heat related illnesses are spiking and here's what we can do to help, that kind of stuff.
Great. I see Jesse dropped some information in the chat about themselves, and so said their manager at the faculty and research manager at the Center for Wildfire Smoke Research and Practice. Here to listen in as well and work with local public health in Oregon quite a bit, as well as land managers and others who would benefit from this information. So yeah, so I will pull up again. So I'll pull up a few things here. I also see some sharing of like resources in the chat, and that is part of kind of the raison d'etre of this forum, is like to get people talking and sharing the information that they have and the work that they're doing. So please check out the chat. If you don't have access to some of the messages, let me know and I can drop them in again. I wanted to just share with you, let me pull it up here quickly. I will share with you our collaborative tools. I think these are really places where people can come on our website to share their ideas. So we'll pull this up here. There we go. This is our website here. This is our measurement bank. So our measurement bank has just been started. So you can see there's nothing yet. These are our newest guidelines. But there are a few things in our heat impacts of heat-related illness and smoke. So this is the purpose of this. We recognized when we were writing these guidelines that there wasn't really a way to measure some of the ideas that the work group was putting forward about best practices. And that not everybody had, there are some systems in place, but maybe they're not all aligned. So Labor and Industries and DOH dropped in their definitions that they're using to measure different things. There's a lot of conversation as these guidelines were being developed about what is a smoke-related illness or a heat-related illness. How deep down do you go? So that is the purpose of this particular measurement bank. And all you do is just fill out the form. It comes to me in an email and I put it in here to share it with people. It's a pretty straightforward process. And then you can pull these, so you can create your own metrics if you would like to, or for research or whatever else you are interested in, by using some of these codes or queries. You can see that some of them have different purposes and different uses. So this is just one of our collaborative resources. The other one that I would like to show you is our survey bank. So similar to Janet, we develop case studies, and by the way, we are happy to develop any case studies with you. If you'd like some support and evaluation, we would be more than happy to do that. And our services are always free since we are uh, um, defined by the legislature. We're required to provide free services to folks. So this is an example if you are developing any sort of questionnaire, research plan, evaluation, you can put your survey, your home developed survey in here, and other people can use it. And some of the benefits are that like you can go through us and get a bigger sample size. Like if you think that your survey is small and you want a bigger sample size, we can bring together the people who have used that survey to see about combining their data. This is an example of one case study that I'm working with. So ESD 105 developed a survey for school nurses on asthma care plans. This might be useful to this group, I think, really finding out how nurses at different districts are developing their care plans and communicating with parents and doctors. And I know asthma was one of the conditions that was chatted about in these guidelines. I'm going to pull up my again. So these are links to our scorecards, and our scorecards are measuring fidelity with the Bree guidelines. I'll drop the link in the chat to our guidelines as well. These are, you can get a sense of what they are from these, but these are really to measure your fidelity. They are not the full guidelines themselves. So we have for many different kinds of audiences. As you can see, so we have Department of Health, and this could be any Department of Health. It doesn't have to be Washington State Department of Health. That's who they're aimed at, but they're pretty universal. So I will stop sharing again. These slides are going to all come out to you guys. And I see there's some more information in here. Let's see. Yes, I could drop a link in the chat. I will drop a link in the chat for all of these, the measurement bank and the survey bank, and the evaluation tool depot in case you want any evaluation tools. And Erin, I am just wondering if you might be interested in talking about the resources that you dropped into the chat.
Oh, sure. Turn my video back on. Looks like Jess also mentioned one of the documents too. The On Air Now, which is a great resource. Hopefully folks are aware of it, especially the fire and smoke map this time of year. We also have a whole bunch of different resources about who's vulnerable, in particular to air quality issues. But one of the EPA is certainly recognizing that a lot of our communities are experiencing smoke and heat at the same time, and trying to compile what exists about the joint evidence and recommendations for people during that time. It's tricky, as you know. And so the fact sheet that I posted there is the latest and greatest from what EPA has about how to protect yourself during smoke and extreme heat. So that's that first link. And I don't actually know a ton about the second one. I just got it like an hour ago, but some partners at NOAA reached out about a drought and health conference that's coming up in St. Paul, Minnesota in September, October, where they're really encouraging participation by a great range of disciplines for probably some similar sets of issues. And then I know Jess doesn't have a mic, but the work they do is awesome, and definitely recommend taking a look at some of the resources that they put together with the Fire Science Consortium that are big approach that we're trying to push is for communities to be smoke ready, but of course heat ready too. And thinking about some of the infrastructure they need in place to keep cool and clean indoor air spaces at homes, but in homes, but schools, senior living facilities, probably a lot of the vulnerable places you're talking about here.
Yeah, so our guidelines address a lot of those. I dropped a link in the chat at the very end about our guidelines, and they really flesh out what should people be doing, what resources should people have available to them. I think Janet's project is a really great example of how a community-based organization is kind of picking up these guidelines and implementing them in a way that has a lot of fidelity with our recommendations. And I would really hope that we can connect more. I think one of the things that Janet is interested in is kind of rolling out like a model of providing heat pumps to low-income folks. There's a lot of questions as our work group was being as they were developing these guidelines about how to do that. The other thing that I think that her case study is great for is how to measure um, the impact of these. So the Bree has lots of measurements already recommended in this framework on how people can measure it. The goal is kind of a public healthy one, I guess. Like we want people to be able to convene in a way that aligns measurement, even if those organizations aren't involved in public health. So measuring for everybody is really what we're interested in. And I would love to.
Can I just say, Carrie, that
Yeah.
what we're finding, at least in Thurston County, is that the Thurston County Health Department, they just don't have the resources right now, and so they were very interested in partnering with us to get the word out. And we collaborated with them and showed them what we were working on, and they made comments and which we included in our work. So, but I think there's still a lot of work to do, especially in the Pacific Northwest, about educating people about the dangers of smoke, the dangers of heat. You hear it on the news all the time, but they don't tell you, they just tell you it's happening. They don't tell you the dangers. They don't tell you how to protect yourself. And so that's something that we as a nonprofit felt, because we do climate change, but we also do mitigation and resilience. And so we felt it was important to get this information out to people.
Yeah, and Janet, I see that the HCA has dropped off, but can you mention maybe how you are thinking about connecting with the Department of Health or the HCA later on in terms of making sure that your information is all the same? Have you
Well,
gotten that far yet?
I had a meeting with the Thurston County Department of Health and showed them our materials, and then we had a meeting and discussed what they wanted us to change. It was very slight, but we want to have the same message going out,
Right.
and they just don't have money to do this right now, so they want to help us get the word out. And so we're developing materials, educational materials, and an educational presentation, and then they're going to help distribute. So
Yeah. I also wanted to share with you where you can get all these resources in a kind of a more compact place. So on our website here, you will find this Bree guidelines tab, and you can just click on that and you will get a whole list of topics. And if you click in the general section here, you can see that this will take you right to the report. But if you click on that, it will take you to this implementation guide. In it, you can read a report online. We have these little checklists that you can go through to think about how to plan an implementation. all of the resources and tools. So Air Now is like the first one that they have there. So all of these are resources that the work group recommended. And we have tools for clinicians. So it's kind of, I guess I would say it's like a one-stop shop for all the tools. And then this one needs to be moved. Because we have a whole section for it. So in our section, this evaluation matrix here, you'll find it's it underpins logic models and it underpins our framework. We kind of think it helped us as we were developing this plan, kind of think through like, what is the component of it? Is it education? Is it services? And then what are we recommending that everyone do? And then how should that be measured in a way that is aligned with everybody? And it's just a simple Excel table. The framework, which I think you guys will be most interested in, is really laying out how to do different evaluations. A lot of your guys' organizations won't need to know the how, but may be interested in the what to evaluate. Whereas this is meant for everybody. So this framework is also meant to help like these very small organizations who don't have an evaluator, like Janet's, who don't really know how to do the how, haven't been in touch with the Bree, but are interested in doing it. So it kind of lays it out for them how to do it. And then we have some tools like this example template where you can plan how you're going to collect your data. Our theory of change. For this overall, we haven't completed it yet. And then here are all the scorecards that I mentioned. So these are our first ones. We've put them into GIS. You can go back in and you can start them. You can kind of measure a baseline and then come back later and edit it. You can download it. There's lots of different things that you can do with it. You can also submit these for awards too, which is, I think, one of the strengths of the Bree. So, was it Joshua? We're very interested in learning about what people are doing in other states. So if you felt like you wanted to look at this kind of these state agency scorecards and submit for an award, we would be more than happy to give out awards to anybody who submits a scorecard. And I can talk more about those if you guys are interested. And before we do that, I wanted to pull this up. So this was developed by this large subcommittee of the work group. And it really looks at, it kind of defines everything that was in the guidelines. Let's get that and that. And so this is, I think, one of the more important sections of this framework is the metrics alignment. This is where we really talk about different kinds of measures. The work group has really thought through how to measure whether or not their recommendations are getting done. So you can see here that some of the chronic conditions that they've listed, pregnancy, behavioral health medications. So these health risks are the priority populations that the work group decided needed to be addressed in order to improve response to climate change and to heat and smoke. And then these are the social risks as opposed to the health risks the report outlines. So these are all, as you can see, some of them have codes. but some of them don't, and that's where our measurement bank comes in. So if new codes are available, people can put that in there. If new metrics are developed, they can put those in there. These are structural measures. So if you're thinking about some sort of capacity program and you want to think about, did we put in more cooling centers? How many people have, access to cool places? These are some of the concepts for them. And again, this is where the measurement bank can come in handy if you flesh this out for yourself and say we measured these people using this data, this code, and share those with people. It can help flesh these out so we have a broader understanding of what structural change looks like as people are starting to implement this. Capacity measures are, similar. And then we have some impact measures. So morbidity and mortality were the impacts that they were most interested in looking at. And the guideline defines all of these. And then this next section is really about the types of evaluations. So this is where it gets into, if you're a small organization or haven't done an evaluation before, how do you do that? What kind of questions do you ask? But it also gives these kind of recommendations. Scroll down to that. Yeah, so here we go. So it gives some recommendations about what to include and what not to include, or well, more what to include in an evaluation. Because, somebody could go in and do a literature search and find out about different studies that were done, different case studies that were done. It's hard to kind of pull them all together sometimes as a researcher. And so we really wanted to give people the opportunity to think about adding all the same perspectives into their evaluations so that in the future, going to do research on how this has impacted anything, there will be some common elements in them. So for each kind of evaluation, we give these kind of strong recommendations and some more soft recommendations. Surveillance was a big part of these recommendations. They really recommended surveilling risk and surveilling population health. So we have some recommended methods, different things like that. Some of them are already being done. And then we include the Air Now and the heat risk tool to measure different, to assess people's use of them. Then impact evaluations are really about the public health side of it. So DOH and the Healthcare Authority are planning to do some impact evaluations. And the idea is that other organizations, maybe different states, maybe smaller community organizations, maybe health systems, might also build out these measures so that the state can have a better understanding of the impact of heat mitigation efforts. We have some guideline logic in here, some information on just evaluation questions that we are interested in. These can be, if you have a question around these and you would like the Bree's help in developing a case study or developing a study, or connecting with people who are asking the same questions, that's kind of what this section is about here. And then there's some more contextual factors. So we move down to here. Those are all standards. Here we go, contextual factors. So we're also kind of recommending like what sorts of things should you consider when you're describing your setting, and you are wanting to do an evaluation. Everybody's going to have different contextual factors, so we want some people to measure them in similar ways. Like we think you should include your geography, you should include demographics, you should include some governmental relationship information, existing infrastructure, and the types of work that people do in your state are like important things to think about as you are planning any kind of implementation project and any kind of evaluation project. So that's kind of the summary. There's a few recommendations, like where should you collaborate with the Bree, where it would be optimal for you to collaborate with the Bree Collaborative, these green boxes here. And then some other initiatives that are around that you might consider in your evaluation. And then general methods. So it's a pretty comprehensive document. This is the first year that we have done this kind of work. And so I see some more comments, which is involved. So Jesse is asking about the Northwest Air Quality Communications Group, and I have not heard of this, Jesse. That is very interesting. They have a library of resources that are logo free. Participating organizations involve pool funding together to pitch an initial cost and develop a shared library. That's very interesting. Yeah. I have not heard of that one. I appreciate you sharing that one. And then Nez Perce Tribe. Great. And excellent. Yeah, those are all excellent resources. I appreciate you sharing them. Are these all resources that you guys on the call are familiar with? Anybody else? Joshua or Angela, are you guys familiar with these resources as well?
No, I'm not.
Okay. Are there other types of organizations or other sorts of resources, pinch points that you guys are aware of? Places where you just struggle that would be useful to talk about? Okay. And Joshua, so in Idaho, are you guys kind of doing your work kind of Idaho specific? Not really comparing to other states or stuff like that yet, is that, or what is what does that look like for you?
Yeah. So a little bit of both. Like, my air quality one is right now really just an internal dashboard for my EPIs. So I haven't taken that one to the public yet. But on the flip side, I personally, pretty much all of my dashboards, I try to look and see what other states are doing,
Mhm.
to try to get a idea of what is relevant and what everybody is trying to see. Completely off topic, I have a dashboard that I created on suicide awareness for our suicide team. And so that one, I really made sure to try to look and see what other states were doing, and try to not just show essence data for suicide attempt in suicide ideation, but like a holistic approach to everything that had to do with from everything and help resources and everything.
Mhm.
And so I know the suicide team's gotten a lot of call outs on that because other states have like little bits and pieces, but I guess maybe we're one of the only states that have like such a huge resource for everything in just one location. And so I do try to compare my stuff to what other states are doing just so I can see what's working and what's not. Yeah.
Yeah. And Angela, how about you guys? How about you? Are you guys working to do any sort of comparison in your work yet, or?
Not that I'm aware of, no, not this time.
Okay. Yeah, so the vision of the Bree guidelines was really for alignment across many different types of organizations that are all doing something a little bit different. Um, and one of the things that the Bree would like to kind of venture into is pulling together these groups to talk more about implementation and about evaluation in an aligned way. So some of the ways that we do that are through the tools that we put out, but also our implementation manager has what she's calling affinity groups. So you can get together and chat with people who are doing similar work. So you don't have to go to their website or call them or whatever else. You can just chat with them. And they work on projects together. They work on projects, I should say. They work on their own projects together. Is a more accurate statement. So providing support to each other. I call them study partners. Um, they kind of or study buddies, I guess. They kind of help each other think through the problems that they're having. Um, Great. And Jess, thank you so much for that. So yeah, so the framework is another way. I am hoping to have, in addition to our or implementation affinity groups, I'm also helping to develop evaluation affinity groups where people are asking, are we measuring the same things? And being able to compare and share these resources. That's really the purpose of all of these tools. So, I see we just have 10 minutes left. And what I wanted to get from you guys is just some ideas about what sorts of formats would work for you. Would it be like a listserv? Would it be some more forum opportunities like this that were more structured with a single topic? Um, would it be different webinars where people could present to each other? Like what would be a good format for you to learn more about how people are measuring their work?
I guess I'm the only one left with a microphone. Um,
I think Janet has one too. That's all.
yeah, this kind of stuff works for me.
Cool.
I like this format.
Janet, how about you? Do you feel like having more ability to kind of chat if we had a single topic, like
I mean, I like both. It seems like a lot of people here are reticent to talk, which is
yeah,
kind of too bad because, I don't feel like, I mean, there's a lot of good expertise here. It would be good to hear about. But I think also, maybe something like, what did you mention the first thing? Where people could be part
like
of a group where they could, look at topics that they're interested in and comment on those and share their ideas too, and a less maybe some people here are shy or something. I don't know.
sure.
But especially when you're talking about a wide range of people and they don't really know each other, sometimes doing something a little more anonymous feels more comfortable.
Yeah. So a listserv, and I see Jess said, having a topic focus group can be helpful if there are questions and on things that we're doing. Yeah. Yeah, so my goal was like to dip my feet in the water of these evaluation forums, see who's interested, let those people kind of pass this information on to others. So it sounds like maybe Jess, we could connect about the Oregon Health Authority and um, see about bringing groups together so they could have more focused conversations. This is really an introduction. Yeah, I think I always find that, the water cooler uh, aspect of work is sometimes missing these days. And also, if you're trying to work with organizations that are in different states, it just isn't possible. So I'm hoping to create a sort of water cooler environment where people can chat and learn more too about what other people are doing, maybe collaborate on different things.
You know, there's a lot of information out there. Like, well, we were putting together some of our information, and a lot of it's similar. And so I don't think I'm like all for collaborating because there's no use on reinventing the wheel when a lot of the
Right.
information, even though we're in different states, that, how to protect yourself from extreme heat is the same. How to protect yourself from smoke. How you measure. I mean, we should all be great if everybody was kind of measuring things similarly so that we could share information. So.
Yeah. Yeah. Okay, cool. Well, my follow-up for this meeting will be that I'll send out an email. I will send you guys also all of the resources that everyone put in the chat and the resources that the Bree has. And then I'm planning to conduct these forums through the end of the year for our topics. And then for the next year, I'm going to try and come up with within our resources what would be most useful for people. So I'll see about setting up a listserv or coming up with more opportunities for forums or something like that. And in the meantime, feel free to use any of these resources. If you are interested in the people who created these guidelines, getting in touch with them about what they're doing, we can facilitate that as well. And yeah, and this is recorded, so I will put this on our YouTube channel. It's not very exciting YouTube channel, but it'll be there if you want to review anything that anybody said here or get it, couldn't remember somebody's name or anything like that. You can check that out. So thank you guys very much for all of the information that you shared today, and I will be back in touch with you about kind of next steps for more collaboration.
Thanks, Carrie.
Thanks,
Thank
Carrie.
you. Thank you guys for joining. Take care.